First of all, in regard to the unfolding issues on the North Coast, clearly there are issues to be managed, and the public health officials, Dr Chant and her team, are managing those as best as is possible. There is, however, one major festival that was to occur, is occurring at the present time, and that is the Blues Fest Jazz Festival, commencing tomorrow. I have been in discussions this morning with the organisers because there is a high level of concern from our public health officials that with these new cases that have come from Queensland and then the newest case that we've heard about just overnight, that we all need to be on high alert. What I would say is that if it were absolutely safe, then we wouldn't be making this comment. But at this stage we do have concerns, the government has concerns, I have concerns as Health Minister, that having 6,500, 9,500 people up to about, I think it's about 15,000 on any one day, could be a challenge if some of these people who may have got the virus from this infectious group that, as I said, came unfortunately from Queensland, could cause some concerns for us, particularly if there were further transmission of the virus. So those discussions this morning have been with the organisers. We've expressed our concerns and noted that we'll be working with our public health officials today. We've asked for some information from them and they've been very, very obliging on that front. That is the organisers and the public health officials. It's difficult. It would have been better if the Blues Fest had been perhaps in another few months instead of right now, or it would have been better if we hadn't had a HEN'S party in Byron Bay that appears to have now brought down our more secure North Coast area into now a highly suspect area. So at this point, all I can say to those people who might be intending to attend and to the organisers themselves, which I've expressed to them personally, but to those who might be intending to come, just be very alert to the messages that will come from the New South Wales Government in the next 12 to 24 hours as we look at the unfolding situation on the North Coast. It is important that, and complex, so complex, that we weigh up the competing interests of trying to let people do what we've always done in New South Wales, and that is have as much freedom as possible to enjoy what New South Wales has done so well, what has been referred to as gold standard approach to managing this virus, but also to make sure that we keep people safe. So it's not an easy one. Can I say on the other front the Premier talked about, in terms of news reports today about the vaccine that appears to have emanated from the federal government, those news reports. Let's get this really, really clear. The New South Wales Government was asked to roll out 300,000 vaccinations to the groups in 1A and 1B. Of that, we've done 100,000. The federal government was asked and is responsible for 5.5 million people, and they've rolled out 50,000. I think the figures speak for themselves. Now, up until today, for 15 months, every government in the country, every state and territory government, has maintained a very collegiate approach because we want people to feel confident in a collective government decision, federal and state. But as Health Minister here in New South Wales, I'm extremely angry. And I know there are other health ministers in the country who share similar views, state and territory health ministers. It is not appropriate that we wake up and find figures put into the media that haven't been shared with any state or territory governments. It is not appropriate that those figures be put in a light that is quite misleading. I can assure the community that your state government here in New South Wales is doing everything possible to roll out the vaccines that we are given. As long as we get the plans going forward for the correct amounts of vaccine, we will roll it out as quickly as possible. I want to remind the community here in New South Wales, as the Premier just did to some extent, that the people who are doing the rollout are our frontline health staff, our publicly employed frontline health staff, and of course the federal government are relying on private companies and GPs. I think we've all heard some complaints in the media from GPs about that rollout, and we know that many aged care facilities that were expecting to see the vaccine haven't got it. I think that's understandable because it's been difficult for the federal government to know what amount of vaccine, particularly the AstraZeneca, would be available, having in mind the problems that were existing in Europe. And they've been reliant on the CSL rollout from Victoria. And we've been understanding of that. But to then go dumping figures into the media, which actually are quite misleading, is wholly inappropriate. Very, very disappointing, and I think is not really helpful in ensuring community confidence. So let me make it very clear. I'm as angry as I have ever been in this 15 months of war against this virus. All governments in Australia should be working together. Can I point out also that just in New South Wales alone last week, we're in week 6. We're in week 6. Last week was the 5th week. We were under the impression from the advice that we'd received from the federal government that we'd receive around about just over 13,000 vaccines. What they actually gave us with no forward announcement was 45,000. And now, less than a few days later, there's a press report saying we haven't distributed them all. Well, you get 45,000 items dumped on your front door at night and told, well, now you should have it out by the next morning. No one would be able to do that. And I've got to say that I know that our frontline health staff, our public health staff, have been working into the wee small hours, night after night, to do what they've done in the last 15 months. One day we're the gold standard, the next day we're being told we're not. Well, we are still the gold standard because we have amazing frontline health staff. And if we're given the clear evidence and indications of what we're going to get, we'll work to that. But, as I said, not happy at all today, and I think that the federal government should be proffering some apologies to not only our government but other governments around the country, because you need to know, if you're going to win a war, you can't have the tanks and the artillery all dropped at the airport and told about it and then go public about it a few days later. You've got to know what your supply lines are and you've got to be able to work to those. And we are at the front line of a war, New South Wales and the other public health teams, and we have been doing a very good job with our public health officials working hard. I really find this very offensive.